Hi, this is Dr. Yogita, physical therapist from AIG Hospitals. In this video, I'll be talking all about myofunctional therapy for sleep apnea patients. So as we all know, sleep apnea is a problem where there's a collapse of airway during sleep. And this collapse is mainly due to weakness in your throat muscles, in your tongue muscles and your facial muscles. And myofunctional therapy exactly targets these muscles. It is a set of exercise where it will strengthen and build the tone in these muscles. So once these muscles are stronger and coordinated, it will prevent your airway from collapsing. So let's see what these exercises are. Now before demonstrating with the exercises, let me tell you, these exercises are very safe and easily doable at home. The first exercise is stand in front of the mirror and say vowels clearly and loudly as if you're exaggerating each of them, like A, E, I, O, U. So this will strengthen your throat muscles. Second exercise is you have to open your mouth and make a click sound with the tongue. Third exercise is just stick your tongue out as much as possible for you, hold it for 10 seconds and repeat for few repetitions. Fourth exercise is you have to put the tongue at the roof of your mouth and press the tongue against it. Again, hold it for 10 seconds and repeat for few repetitions. Fifth exercise is put the tongue at the back of your bottom teeth, press against it and hold for 10 seconds. Then the next exercise is you have to open your mouth and move your lower jaw towards the right and towards the left. Then coming to your facial exercises, first facial exercise is purse your lips and smile. So purse your lips for few seconds and then smile for few seconds. That will again activate your facial muscles. Next exercise is spoon and tongue exercise. And then you can even try blowing balloons. You can even try drinking water from the straw. Each exercise should be done for 10 repetitions and 30 minutes in a day. Myofunctional therapy can be a great complement to CPAP therapy. In some cases, it also helps in reducing dependence on the CPAP. And at the last, you have to remember, better sleep starts with better function. Thank you.